The submandibular region. The submandibular region. The submandibular region is below and under the cover of the body of the mandible. It extends upwards up to the mylohyoid line and below up to the hyoid bone. Superficially, it includes both submandibular and submental triangles. The deep structures in this region include floor of the mouth and the root of the tongue. Clinically, this region is very important because it is the commonest site for swellings due to enlargement of the submandibular lymph nodes and submandibular salivary glands. The inflammatory edema of the floor of the mouth, called Ludwig's angina, spreads in this region to cause generalized swelling of the region. Superficial structures in the submandibular region. The submandibular region is crossed superficially by platysma in the superficial fascia. Deep to platysma, the marginal mandibular nerve, lowest branch of facial nerve, crosses the lower border of the mandible near the angle and runs below it across the submandibular region before turning upwards to reach the mental region of the face, where it supplies depressors of the lower lip. Depressor labii inferioris, depressor anguli oris, and mentalis muscle. The surgical incisions are, therefore, not made along the lower border of the mandible to avoid injury to this nerve. The great auricular nerve crosses the posterior belly of digastric on its way to supply the skin of face and auricle. Deep structures in the submandibular region. The deep structures in the submandibular region. Suprahyoid muscles, all paired, viz. Digastric, stylohyoid, mylohyoid, and geniohyoid. Extrinsic muscles of the tongue, all paired, viz. Hypoglossus, styloglossus, and genioglossus. Submandibular and sublingual salivary glands. Facial and lingual arteries. Lingual, hypoglossal nerves. Submandibular ganglion. Muscles of the submandibular region. From the point of view of surgical procedures, the muscles in the submandibular region form four muscular planes. From superficial to deep, these are: first, muscular plane, formed by the digastric and stylohyoid muscles. Second, muscular plane, formed by the mylohyoid muscle. Third, muscular plane, formed by the geniohyoid, hypoglossus, and styloglossus muscles. Fourth, muscular plane, formed by the genioglossus and a part of superior constrictor of the pharynx. Muscles of first muscular plane. Digastric muscle. It is a strap-like muscle consisting of posterior and anterior bellies, united by an intermediate tendon. This muscle is so called because it has two bellies. Origin. The bipinnate posterior belly arises from the mastoid notch of the temporal bone. The unipennate anterior belly arises from the digastric fossa on the lower border of the mandible, close to the symphysis mentae. Insertion. Posterior belly passes downwards and forwards between the carotid triangle, below and behind, and digastric triangle above and in front, inserted into the intermediate tendon. Anterior belly passes downwards and backwards on the mylohyoid to be inserted into the intermediate tendon. The intermediate tendon is anchored to the junction of the body and greater cornu of the hyoid bone by an inverted U-shaped fascial sling of investing layer of deep cervical fascia. The tendon of digastric muscle passes between the two slips of tendon of stylohyoid muscle. Nerve supply. The posterior belly develops from mesoderm of the second pharyngeal arch and therefore supplied by the facial nerve. The anterior belly develops from the first pharyngeal arch and therefore is supplied by the mylohyoid nerve, a branch of the inferior alveolar nerve from mandibular nerve. Actions. Helps to depress the mandible when the mouth is opened widely against resistance. Pulls the hyoid bone upwards during deglutition. Stylohyoid muscle. It is a slender muscle that lies along the upper border of the posterior belly of the digastric muscle. Origin. It arises from the posterior surface of the styloid process. Insertion. It is inserted into the hyoid bone at the junction between the body and greater cornu. At the insertion, its tendon splits into two slips that pass one on either side of the intermediate tendon of the digastric muscle. Nerve supply. The stylohyoid muscle develops from the second arch and therefore it is supplied by the facial nerve. Actions. It draws the hyoid bone upwards and backwards and elongates the floor of the mouth. Muscles of second muscular plane. Mylohyoid muscle. It is a flat, triangular muscle lying deep to the anterior belly of the digastric muscle. The right and left mylohyoid muscles join in the median fibrous raphe to form the gutter-shaped floor of the mouth, over which lies the tongue. Hence, the floor of the mouth is also called diaphragma oris. Origin. From the mylohyoid line of the mandible. Insertion. The fibers run downwards and medially. The posterior fibers are inserted into the body of the hyoid bone. The middle and anterior fibers are inserted into the median fibrous raphe, extending from symphysis mentae to the hyoid bone. Nerve supply. The mylohyoid muscle develops from the first pharyngeal arch. Therefore, it is supplied by the mylohyoid nerve, a branch of inferior alveolar nerve from mandibular nerve. Actions. The mylohyoid muscle elevates the floor of the mouth and hence the tongue during the first stage of deglutition. It also helps in the depression of the mandible against resistance. It fixes or elevates the hyoid bone. Muscles of third muscular plane. Geniohyoid muscle. It is a narrow muscle that lies alongside the midline deep to the mylohyoid. Origin. from inferior genial tubercle of the mandible. Insertion. The fibers run backwards and downwards to be inserted into the anterior surface front of the body of the hyoid bone above the medial part of the mylohyoid muscle. Nerve supply. C1 fibers through hypoglossal nerve. Actions. The geniohyoid elevates the hyoid bone by pulling it upwards and forwards and thus shortens the floor of the mouth. They may depress the mandible when the hyoid bone is fixed. Hypoglossal muscle. It is the flat quadrilateral muscle of the tongue. Origin. From upper surface of the entire length of the greater cornu and adjacent part of the body of hyoid bone. Insertion. Into the side of tongue between styloglossus laterally and inferior longitudinal medially. The fibers of the hyoglossus from hyoid bone run upwards and slightly forward and decussate with the fibers of styloglossus. Nerve supply. The hypoglossal muscle develops from the occipital myotomes. Therefore, it is supplied by hypoglossal nerve. Actions. Depress the side of the tongue to make the dorsal surface of the tongue convex. Helps in the retraction of the protruded tongue. Styloglossus muscle. Origin. From front of the tip of styloid process and adjoining part of stylohyoid ligament. Insertion. The fibers run forwards to be inserted into the whole length of the side of tongue, interdigitating with the fibers of hypoglossal muscle. Nerve supply. It is supplied by hypoglossal nerve. Actions. Retracts the tongue upwards and backwards, and thus it is antagonist to the genioglossus. Muscles of fourth muscular plane. Genioglossus muscle. It is a fan-shaped extrinsic muscle of tongue, and along with its counterpart of the opposite side forms most of the bulk of the tongue. Origin. From superior genial tubercle of the mandible. Insertion. The fibers radiate backwards, fan-wise into the substance of the corresponding half of the tongue, alongside the median septum, from the tip to the base for insertion. Lower fibers are inserted into the body of the hyoid and form the root of the tongue. Intermediate fibers pass beneath the anterior border of the hyoglossus and extend backwards up to the stylohyoid ligament and middle constrictor of the pharynx. Upper fibers turn upwards and forwards to extend up to the tip of the tongue. Nerve supply. It is supplied by hypoglossal nerve. Actions. The muscles of both sides together protrude the tongue and make an elongated gutter on the dorsal surface of the tongue for the passage of food.